Okay. I will start by reviewing my patient's diagnosis, the MD's orders, and the frequency of the orders. I'm also going to look at my nursing notes, my patient's allergies, and the Institute's policies regarding a sterile dressing change. I got my supplies, which is my sterile gloves, my 2 gauze, my abdominal pad. I have my hand sanitizer here, my 2 alcohol pad swabs, my 2 working gloves, and I also have my saline. I'm gonna wash my hands. Now I'm gonna go knock on my patient's door, and I'm gonna go introduce myself. Hi, my name is Sam. I'll be performing your dressing change. Can you please state your name and your date of birth? So my patient tells me their name and their date of birth, and I'm gonna verify that looking at the wristband. Do you have any allergies? My patient says no, that they do not have any allergies. Are you in any pain from a scale of 0 to 10? My patient says no, they have 0 pain. Perfect. I'm going to provide privacy to my patient, pulling the curtain closed. I'm going to make sure that my patient's bed is locked, and I'm going to elevate it to proper working height. I'm going to sanitize my hands. I made sure that I gave my patient pain medication 30 to 45 minutes before this procedure if they needed it. My patient is in a supine position and draped with a bath blanket. I'm going to put my working gloves on. And now that I have my working gloves on, I'm going to grab my alcohol swab here, come over to my patient, and I'm going to gently go around the dressing, wetting the tape. And I'm wetting the tape so when I pull it from the corners to the center, it comes off easier. Okay. So I'm wetting it around the tape, and now I'm pulling it from the corners to the center, not the side. Okay. So now that I removed the dressing, before I dispose of this, I'm going to look at it and note, so I can note the odor, the color, the consistency, and also the amount. I'm going to dispose of this now. Then I'm going to come back to my patient, and I'm going to look at their incision site, and I want to note any edema, approximation, redness. I'm also going to look to note the measurements, so the width, the length, and the depth of the incision. Okay, so now I'm going to take off my working gloves and dispose of them and sanitize my hands. Now I'm going to get ready to prep for my setup. So I'm going to take my alcohol prep pad, and I'm going to wipe down this table before I place anything on here. This table is considered non-sterile because it's below my waist. If it was sterile, it would be at my height, my waist height. Now I'm going to set up my pads here. So I'm right-handed, so my abdominal pad is going to be furthest away from my patient, and my gauzes will be closest to my patient. Because when I'm opening the pads away from me, the area also above needs to be sterile. So I'm putting my pads, my abdominal pad here, my 2 gauzes here. Okay. And when I open them, I'm going to make sure I'm opening away, and that I'm not crossing over the sterile field. And I'm making sure I'm not hunched over. I started the farthest away, only touching the 1-inch border and not crossing my sterile field. Okay, so now that we opened our pads here, I'm going to grab the saline. This saline was never opened, so when I open my saline here, I'm going to wet the rim of the saline. So slowly lightly, just a little bit, wetting the lid of my saline here to clean it. And again, you do this if it was never opened. Okay. So now that our lid is clean, I'm gonna look and verify that this is normal saline, that it isn't water. So here it says normal saline. I'm also gonna check the expiration date. So it says August 2022. Now I'm gonna come high over my dressing and try to stay back. And I'm just gonna put a little bit of saline on each gauze here. There we go. I stood back, I did not hunch over. Now we're done with this. Okay, now I'm going to don my sterile gloves. Making sure I stay away, not hunching over. When I open it, I'm only touching the 1-inch border. Only touching the 1-inch border. Here we go. Only touching the 1-inch border. I'm going to don my dominant hand first. So I'm going to come in with my non-dominant hand and I'm going to reach in for the cuff. So I'm going to pick up my cuff here and I'm going to step back. Now I'm going to slide my right hand into my glove and just pulling. Now I'm going to take my 2 fingers, keeping my thumb up, and I'm going to scoop underneath the cuff, making sure I keep my thumb up because the inside of the cuff is not sterile. So I'm coming in. Okay. Now I got my cuff up. Now I'm making sure I'm staying under my cuff here and pulling up. And now I'm keeping my elbows tucked in. And now we're ready to begin dressing the wound. So I'm gonna come in with my first gauze using my dominant hand, and I'm gonna pick it up. I'm gonna come over and I'm gonna clean the patient's wound, distal from top to bottom, and dispose. I'm using the same hand, so my other hand is tucked in. Using the same hand, I'm grabbing my other wet gauze. Now, proximal side, top to bottom, and dispose. Now, I'm not going to use this hand anymore because it's contaminated, so I'm going to close this one, and we're going to use this one to grab my abdominal pad. So, picking up my ABD pad. Making sure I can touch the middle of this here. Okay. And I'm going to put it in the middle of the incision. And now I'm taking off my sterile gloves. I'm going to sanitize my hands, and now I am done with my sterile field. I'm going to put on my new set of working gloves. I'm gonna grab my tape so I can tape my dressing up. I'm going to date, put my initials, and also the time of when I changed this wound. And I'm gonna tape it like the frame. So I tape both sides, I tape the top, and now I'm taping the bottom. Okay, so I'm now that I taped both sides and also the top and the bottom of the new dressing changed, I will make sure that I restore the room. I'm going to make sure my patient is in a low position with their call bell. I'm also going to make sure I report and document any abnormal findings and report it. I'm going to record the procedure I did, which was the dressing change, and then I will leave and come back in 30 minutes to reevaluate my patient and sanitize my hands.